Hi everyone, this revision session is going to be focused on lifestyle choices aimed at paper 2 for the GCSE PE, and the main sort of areas of exam questions that have come up and are more likely to come up are the lifestyle choice of smoking, which is a fairly sort of significant area in terms, and sometimes quite difficult to understand, alcohol, sleep, and then an area which is diet and activity levels. So let's get into it. Right, when we're talking about smoking, we are looking at what the impacts smoking has, so the choice of smoking and the impact it has, and generally we want to look at it from two aspects, from lifestyle, from how it affects your life in general and your health in general, and then one, how it can affect performance. So let's start off with life and your health. So smoking is the main cause of chronic bronchitis. Now, bronchitis is the infection of the bronchi in your lungs. So the main airways into your lungs is called the bronchi. There's two of them. So you've got the two paths that branch off into your lungs are called the bronchi. And when you've got bronchitis, they become infected. The reasoning behind the infection is due to the chemicals in the smoke, and these chemicals will damage the linings of the cells lining the lungs, and generally are some of the main causes for all issues with regarding to the lungs and smoking, is that the chemicals will damage those cells. So always sort of have that as your cause for the various sort of conditions. Now, I would suggest you learn in detail at least one or two different conditions. So we talked about bronchitis. The next is lung cancer, which is generally the one most people remember, but then they don't realize how it can occur. And obviously lung cancer is caused by the chemicals, and these chemicals damage the cells. So easy one to remember there, but people tend to forget about the reasoning why lung cancer is caused. The next two are slightly more difficult to remember. We got pneumonia, which essentially is an infection of the lungs, and it can lead to further infections. And then you've got emphysema, which is where your cilia, which are these little hairs inside your lungs that operate to try and clear out any sort of gunk and toxins and stuff like that, and they move and they push this out of your lungs to try and help you cough it out, and they get damaged, so they stop working, and then toxins will not be cleared. So I would always go with bronchitis as the main one, you remember as being the smoking causes bronchitis, and this is an infection of the bronchi due to the chemicals in the smoke. But I would choose one of the other three just to help you back it up. Now, it can also be a multiple choice question where it might give you different conditions and say which is most likely to be caused by smoking, and they might have, say, like emphysema in your multiple choice answers with some other random ones. So look for these four sort of terms when we're talking about smoking. Okay, so why smoking is a poor lifestyle choice for an athlete? So we're going to look at smoking and then choosing not to smoke. So if we take this, and this is sort of written as a peel paragraph where you have a point, an example, and a linking sort of terminology. So I always try to encourage you to write because, for example, and therefore in your answers, and then you know you're going to hit those 3-4 marks. So smoking is bad for an athlete because it reduces oxygen delivery to the muscles, which is always important because any sort of sport and physical exercise needs energy at the muscles, and oxygen is taken to the muscles via your bloodstream, and smoking reduces that delivery. Now, the reasons why is that gas exchange is affected, and the smoking affects gas exchange in your lungs, and it reduces the ability of your body to uptake oxygen. Now, there's one of the main reasons is that carbon monoxide in the cigarette smoke, in the cigarettes, has a greater affinity with hemoglobin. Now, hemoglobin is in your red blood cells, if you remember, and hemoglobin is the substance that grabs hold of the oxygen and holds onto it as it goes around your body to take it to the muscles. Carbon monoxide is drawn to hemoglobin stronger than oxygen, and if the hemoglobin is loaded up with carbon monoxide, then the oxygen is not going to jump on the red blood cells to be able to get to the muscles. So the impact. Now, always think about the impact and think about this idea of fatigue is probably the most common point that I've been talking about in most of these videos. A long distance runner would not be able to maintain their pace, so they become fatigued and they need to slow down. So always try to get in that terminology. What's the impact on performance? They can't run as long and as fast as normal, and they get fatigued. So they can't resist fatigue and they need to slow down. If we flip that around and say, why is not smoking a good lifestyle choice for an athlete? It's sort of like the flip of what we just talked about. So not smoking causes an increase in oxygen delivery to the muscles. So if it's a smoker versus a non-smoker, the non-smoker is going to have more oxygen going to the muscles. Why? Because it's an opposite to what we just talked about. Effective gases exchange, effective diffusion of oxygen at the lungs into the red blood cells. Red blood cells can carry more oxygen because they're not loaded up with the carbon monoxide, and lung capacity can increase because the alveoli aren't damaged by, and the cells aren't damaged by the cigarette smoke and the chemicals in cigarette smoke. Therefore, and this is where the impact on performance comes in, we got more oxygen available for energy, we can run faster for longer, and we can reduce the onset of fatigue. So let's move on to alcohol and look at the impact alcohol has. And generally when we're looking at alcohol, we want to be looking at the impact on performance. More often than not, they ask you questions on what is the impact of alcohol on performance. Now, we're not talking about necessarily a lifelong impact. However, there is an issue with lifelong drinking and it will affect your liver. It will damage your liver, but generally the exam questions want to know what's the impact on performance. So if someone drank before a game of rugby, for example, what would be the impact on their performance? So it's a short-term impact we're looking at, and it has a negative impact on the performance. Now, why? So alcohol is a diuretic. It means you're going to wee more, and it means that you're going to become dehydrated. Okay, dehydration leads to dizziness and headache, so you're not going to be able to. You're not going to be able to focus in a game. You're going to feel unable to concentrate, and therefore your performance is going to drop off because you can't focus on the right things in the game, and the decision making will go slower, and your performance will decrease. So that's probably the easiest one sort of pathway to talk about when you're talking about the impacts of alcohol. You could look at reaction time, and as you're probably aware that alcohol reduces your reaction time. It can therefore reduce your coordination, and people who drunk alcohol, they're not able to coordinate particularly fine motor skills. So those two are linked into one another, but they are two different points. And then the resulting impact is that there's more chance of an athlete becoming injured because they can't react quick enough, they can't coordinate, they get their body in the wrong position, and there's more chance of an injury. Finally, you've got the impact of alcohol on fatigue and why people feel tired when they drink alcohol. Now, what happens is you get a drop in your blood glucose, and glucose is our main source of energy, along with oxygen. So we have a drop in energy levels. The reasoning why is that the energy and the glucose are being used to break down the alcohol, the toxins in alcohol. So your body's trying to clear that out of the way. And because of all of that, your energy levels are low, your glucose is low, and that means you can't work as hard as you normally would, and you start to feel fatigued. And again, remember that impact on performance. It's fatigue, just like all the other times when we're talking about it. And as I said earlier, if the question asks you about what's a long-term impact, well, the liver damage is going to be a long-term impact of alcohol consumption. Now, as many of you get into the exams, you're probably experiencing this, a lack of sleep. Now, generally, the exam questions tend to ask what are the physical effects, or what's the physical effects of lack of sleep, or something along those lines, and it's got the word physical in there. Now, generally, that's the most commonly asked question. However, it could have the psychological impacts of a lack of sleep. That's not as often asked, but you've got to watch out for that word, physical or psychological. So physical on the screen there, you can just pause it and quickly read through them, but I would just choose 2 to 3 examples of physical effects of lack of sleep. So something like heart disease, increased risk of heart disease, increased risk of obesity, and maybe the weakened immune system. And the reasons why lack of sleep is so bad for you. So the first thing, it doesn't allow our body systems to recover from the day's events. And our body systems isn't just a muscular system. We've got a numerous amount of body systems, and they all work to recover while we are sleeping. And in particular, we recover from exercise while we sleep. And most of the gains of exercise are taking place when you're asleep. So your muscles will grow and repair, bone density will increase. All of these sort of gains that we get from exercise happen when we're sleeping, and if we have a lack of sleep, there's less time for that to take place, and we will struggle. So we have these physical effects, or you can have the psychological effects, things like a lack of, your memory might get affected. You might have mood swings, irritability. Now, when you think about the psychological, just think the last time you didn't sleep very well and how you felt. And hopefully that's not the day before the exams. So this question doesn't come up as often, but when it does, it tends to be the physical effects of lack of sleep. So make sure you learn about 3 different impacts of lack of sleep, and then reasons why lack of sleep is not so is poor for your body. Okay, finally, we're going to look at this area. Now, this has come up on a 9-mark exam question saying, analyze the effect that diet and physical activity has on your well-being, or as a lifestyle choice. So if we break it down into sort of AO1, AO2 in the middle, and AO3 at the bottom, it sort of gives you a breakdown of how you might want to approach it. So if we go with the diet side of it first, so there's an element of balanced diet, and we all know what a balanced diet is, but if there's a question on diet, start off with sort of explaining what a balanced diet is, where we need to have the correct balance of essential nutrients for our body to function, macronutrients, micronutrients, fiber and water. And then for the AO2 point, you would explain, well, what are the sort of, if you missed any of those essential elements, what would happen to your body? So, for example, a lack of water would lead to dehydration, or a lack of carbohydrates might lead to low energy levels. A lack of protein wouldn't allow your body to grow and repair. And then you want to go, well, why is that important for AO3? And we can talk about, well, what's the drop-off impact on performance? And if you think back to what we just talked about, with dehydration, it's the same as the alcohol. So, for example, with dehydration, we become more dizzy, we're more prone to headaches, and therefore we can't concentrate and focus on the activity at hand. If we've got a lack of carbohydrates and we haven't got enough energy, then we won't be able to resist fatigue, and our performance will drop off in that way. So try to bundle that as one sort of area, the impact of importance of a good diet. The next lifestyle choice might be linked to physical activity. Now, all sports, well, firstly, we require enough energy to meet the demands which we might get from our diet, but also we must train to improve, right? Training to improve fitness, training to improve performance. So that takes a lot of effort and commitment and time. Now, we as sports performers must have enough time to rest and recover, just as I talked about on the sleep slide just a minute ago. So just link that into it about rest and recovery and what happens. And then our AO3, what happens if our activity levels are unbalanced? So, for example, overtraining could lead to higher risk of injuries, but also having the appropriate rest and recovery period allow our body to create those adaptations where we could get like hypertrophy of the muscles as they're adapting to whatever training session you might have done. And finally, we could link back into energy balance. So if you overeat, there's a higher chance of gaining obesity and associated diseases. So overeating is bad. You could talk about the energy balance there. So it would be not consuming more food or calories from food than you're burning, and therefore that can increase to a weight gain. Or we could go the other way around. Not consuming enough would be under eating, and it would lead to risk of other issues such as osteoporosis and not having enough calcium in your body and not having enough energy, and so on and so forth. So you could talk about those sort of elements there. Then you might want to go on to things like dietary manipulation. So marathon runners might use carbohydrate loading before an event, or particular sports performance might look at achieving a particular optimum body weight, so being lighter. Jockeys in particular, or different events require different optimum body weights. So in terms of your physical activity and diet, you're sort of linking those two together, saying you're consuming the right amount of calories depending on the sport that we're taking part in. So that was a really quick whistle-stop tour of lifestyle choices. I would spend a bit of time making sure we're focused on smoking and alcohol, and then a little bit more time on the sleep, the diet, and the physical activity levels. Right, hope that helps, and good luck in your exams.